Hello, this is Dr. David Tam, President and CEO here at Beebe Healthcare with the third of a three-part special series of Tuesdays with Tam, where we're introducing, in this case, Dr. Diana Dickson-Witmer, a renowned breast cancer surgeon who is now working here in Sussex County at Beebe Healthcare. And this week, we will be talking about you, the patient, and what this all means for healthcare here in Sussex County. If you haven't seen the other two segments, please feel free to go back and look on social media and see the first and the second segments so that you can get the full picture about what we're doing and what Dr. Dickson-Witmer is excited about and what we're excited about with respect to having her here. So Diana, welcome back, and thank you for being here. And I know that the provider-patient relationship is so critical in healthcare. For me, of course, it was always about talking to mom as well as the kid. But in your case, certainly, I'm sure that it is so important when dealing with cancer, when patients have cancer and their families. And can you tell us a little bit about your patient care philosophy with respect to cancer care?
I think the most important thing for each one of us as providers to keep in mind is that the patient is us. We are going to be in that same position, maybe not with the same disease process, but if we live long enough, we are definitely all going to be in that patient's same chair. And so we need to remember all the time that the patient is us, and the patient needs to be treated exactly the same way that we would want to be treated if we were in the patient's chair. And that means with respect, that means being listened to. Doesn't just mean that a provider stops talking for a little bit to allow a patient to talk, but that the provider will actually listen carefully, not have a prejudged plan that's not going to have input from the patient. That the patient is us. And if we remember that, we're going to have a very good relationship with the patient. We're going to also understand that just like us, when we're frightened, sometimes it's more acceptable to express some anger or irritation than fear. So often patients who've just gotten some scary news will be expressing negative, angry sort of emotion, which is just that they're frightened. And after we can manage to reduce their anxiety, that goes away, and that's important to remember.
You know, what you just said really touches my heart, Diana, because all of us, so many of us, have been touched in one way by some kind of cancer. I mean, it is one of the most difficult areas of healthcare and medical care, which is one of the reasons why Beebe is working so hard to bring, specialized oncology services to Sussex County. I can tell you that, when and many of our viewers know this, when my dad was diagnosed with esophageal cancer and then ended up in the hospital because of complications of that, here I am, I'm a pediatric subspecialist, I'm a hospital administrator, I should know all the stuff, and yet I felt so confused. I had to take care of my dad, I had to take care of my mom, I had to explain things to everybody in the family. And this was even before COVID. And so people could still be around. And it was so important to have the oncologist, there to understand, to listen, and to recognize that there are certainly fears and other challenges. And so I'm really appreciative of what you have said and what you bring to the table in terms of how we take care of patients with cancer, especially now here in Beebe Healthcare in Sussex County.
Another thing that's important to me, and I'm very happy to hear that the women's health group at Beebe is also very interested in this, is prevention. Not everybody can do things that will prevent a breast cancer from happening, but there are modifiable risk factors. And it's a lot better to prevent a cancer ever from happening than to treat even an early stage cancer once it has. So I'm excited to work with Dr. Gichuro and the other members of the women's health area to let the public know about how they can calculate their risk of developing breast cancer, what they should do. I'm hoping we can develop a mature breast cancer prevention program that will facilitate getting individuals with a higher than 20% lifetime risk to genetic counseling, if that's appropriate based on their history, to medical oncology, if it's appropriate to consider risk reduction with tamoxifen, and into a surveillance program with me and other members of my group, so that they can have every chance to reduce their risk of developing a breast cancer, as well as to find it early should it happen anyway.
So, Diana, that's a great opportunity for me to ask pretty much the last question for this segment, and that is that, can you talk a little bit about what we've been doing here, what you've seen here in terms of our breast health program or breast cancer program? And I think what's really exciting is what you said about how we here at Beebe Healthcare want to concentrate not just on treatment, but also breast health.
Exactly. And the service line of women's health, I am actually a part of that service line appropriately, because I'm a breast surgeon and I should be a part of a service line that's patient-centered, that's women's health. And what I see is groups of people who are taking every opportunity to help this community understand what they can do to reduce their risk of multiple kinds of illness. And I think that it's terrific.
Well, I appreciate what you're saying, because I'll tell you what, one of the things that I've been working on, and I've been here now almost a year, is how we start looking at, as you said, the patient-focused approach. It's not just breast, it's not just ovary, it's not just uterus, it's not just skin, it's not just the brain, right? It is not just heart, but really all that in this case is comprised of really what boils down to women's health. How to make sure we look at the whole person and make sure that we are doing prevention, and that we are doing diagnosis, and that we are doing treatment, and that we are doing aftercare. And I think that's one of the most exciting things about your arrival and how we are moving forward in that direction. Any last closing statements about that and what you're excited about, what you're looking to do before we close this segment?
I'm also excited about the opportunity here at Beebe to continue to put patients on important clinical trials. It's the clinical trials and their results that are going to allow us to eliminate patient problems in the future, decrease the morbidity of treatment. And Beebe has a robust clinical trial accrual record. I'm hoping that I can contribute to that in a really significant way, and that we can have the answers to many more questions about how can we get the same good outcome for individuals with breast cancer with less negative impact on the person's body and her life.
That's great. And thank you so much, Diana, for taking the time to introduce yourself to the people of Sussex County. But that's all the time that we have for today. Thank you so much for joining us today on another episode of Tuesdays with Tam. And remember, during this difficult time as we continue to push on the treatment for COVID-19, the pandemic. Please make sure that you continue to wash your hands, wear your mask, watch your distance. Um, and please know that we are doing everything we can here at Beebe Healthcare to continue to access and advocate for Sussex County to get part of that growing supply of vaccine that's on the horizon. J&J just got approved, and it's our promise to you, the people of Sussex County, to not leave anyone behind. So please take care of yourself. Make sure you get breast self-exams. Make sure that you get your screening exams. And if you need us, remember, we have more people coming, more specialists coming to take care of you, including, in this case, Dr. Diana Dickson-Witmer for breast health. Thank you, Diana, and have a great day.